what exactly is CAR T therapy?
CAR T-cell therapy is a newer form of immunotherapy.
Which cancers benefit the most from this?
Common cancers and the lymphoblastic leukemia.
Is the hype justified?
Revolution for India because it was properly indigenously developed drug. We all were very excited and there was a lot of hype.
How is it different from chemotherapy?
Immunotherapy is basically any treatment modality where you are actually using the prowess of your own immunity to kill cancer.
Hello, Namaste. My name is Garima Kaushal and today we are here to talk about cancer awareness. With us today we have Dr. Prashant Mehta, Program Head, Department of Medical Oncology, Hematology, Bone Marrow Transplant, Amrita Hospital, Faridabad. Thank you so much, Doctor. Welcome to the show.
Thank you.
And I know your time is very precious, so I'm going to straight get into it. My first question to you is, what exactly is CAR T therapy?
CAR T-cell therapy is a newer form of immunotherapy. So it's basically redirecting your own immune cells, your own T lymphocytes, that is, and genetically modifying them to kill your own cancer. So it is your own T cells. Generally, it is autologous because it is derived from your own blood. It is by a process called leukapheresis. It is extracted and it is genetically modified using a viral vector. And that modified product is reinfused after a small dose of chemotherapy and basically targets a protein on the cancer cell surface. And generally, that could be in the leukemia cells, a disease called acute lymphoblastic leukemia. CD19 is a protein on the leukemia cells. And when you target CD19, it's called CD19 CAR T-cell therapy. So it's a chimeric antigen receptor T-cell therapy, modified T-cell, which is reinfused back into the patient.
Wow, that sounds complicated, but really amazing.
Simply put, it's just modified immune cells reinfused into the patient to kill their own cancer cells. Yeah.
Brilliant.
Simply put.
Genuinely brilliant. And which cancers benefit the most from this?
So in the common cancers and the standard approvals right now are in place for acute lymphoblastic leukemia because it expresses CD19 protein in the leukemia cells. Other approvals are for B-cell lymphomas. So that also the target is the same, CD19. The other approvals are in place for multiple myeloma. There the target is different. It's called B-cell maturation antigen or BCMA. So the principle is the same, but you redirect the modified T cells to kill the cancer cells. So multiple myeloma, lymphoma, acute lymphoblastic leukemia. These are the diseases right now where there is an approval or a drug controller approval for use, for treatment.
And does CAR T cell therapy also help patients that have exhausted all their other options?
Yes, it does. The subset where CAR T-cell therapy has shown efficacy, generally, historically, these patients had a very poor outcome. Yeah. And their survival was dismal actually with the standard approved therapies. So there was something which was needed. It was an unmet need. So this was actually major breakthrough in science, where in around 2012, one of the initial few patients called Emily Whitehead, she was a young girl with acute lymphoblastic leukemia in the University of Pennsylvania, by Dr. Carl June's group. The initial clinical trial was conducted, and she kind of achieved a complete remission despite being refractory to all known treatments. And right now she's alive and disease-free. And she kind of became the poster girl for CAR T-cell therapy. So yes, it can actually cure patients who have refractory illness. But the right patient, the right kind of disease and the kind of, the state the patient is in also matters a lot.
One more question regarding CAR T cell therapy. Is the hype justified?
To an extent, I would say that there was an initial hype, and at that point in time, it was such a big breakthrough and revolutionary, revolution for India because it was probably the first properly indigenously developed drug which came about and came through. So at that time, I would say to an extent, we all were very excited and there was a lot of hype. But yes, hype also needs to be balanced. Yeah. So yes, I agree that everybody will not achieve a cure with CAR T-cell therapy also. And the right subset, the right juncture or right time in the disease course, if it is used well, then you are able to achieve a higher cure rate. But yes, not everybody will achieve a cure with CAR T-cell therapy. Yeah.
Now, this just shows how advanced our research and medicine and treatments have reached. But at the same time, AI is also getting very advanced and very accessible also.
Yes.
So, how do you think AI can, access to care and cancer care in general?
So I think the same question came up when Google and all these search engines, they were actually coming into vogue and people were starting to use it so much. And the doctors used to ask why people are Googling their symptoms and Googling disease. But the same thing with AI. And AI has just come about and like a revolution again. And people are using AI, ChatGPT, Claude for their symptom analysis and finding the nuances about their disease. And I think it's a good thing.
Yeah.
Because I think it assists with information update and also kind of in time it will also prevent misinformation. Because the viral social media, Instagram, reels and everything, very easy to spread misinformation and tons of misinformation.
Yeah.
At least a valid AI
Yeah.
would help with kind of somehow stopping it or regulating it. So I think it is still a better tool than the other social media platforms. So I'm not,
That is
I'm
true,
not, I'm kind of
actually.
not against it.
Yeah.
I
You're
think
actually one of the first people who.
I think it is going to be assistive.
Right.
Assistive not only to people but also to the clinicians and the healthcare team. So I think it's a good thing eventually.
That's true, because I'm also guilty of having used to check my symptoms and.
I don't think if you use it well and don't completely rely on it blindly, I don't think it will harm you. But yes, you have to stay in consultation with an expert
Of
when
course.
using it and when reading through it.
Talking about our advancements in science, we have also something called immunotherapy.
Yeah.
Right. So tell us something. How is
So-
it different from chemotherapy?
Just now we discussed CAR T cell therapy. It's also a form of immunotherapy. Immunotherapy is basically any treatment modality where you are actually using the prowess of your own immunity to kill cancer. So that's basically immunotherapy. And when we, in the common parlance in medical terms, when you use the term immunotherapy, generally it points to certain drugs which are actually blocking your immune checkpoints. And what happens is your cancer is actually able to escape your immunity by a certain mechanism
Right.
called checkpoints, immune checkpoints. So if you block those checkpoints, your immune cells are able to identify and recognize your cancers better. So the escapade of the cancer cells is prevented by immunotherapy by blocking a certain protein, PD-1, PD-L1 in this case, and CTLA4 is also another protein. So immunotherapy basically works by preventing immune escapade. So it is able to prevent the escape of cancer cells from the prowess of immunity, because with immunotherapy your immune cells are able to identify the cancer cells better. So immunotherapy in turn in itself, it's not doing anything but just making the immune system capable of identifying the cancer. And that's how immunotherapy works. That's how it's different from chemotherapy, because chemotherapy is just brute force. It is just killing any cell which comes in the way and any cell which is rapidly dividing. So it is more crude. But I cannot say that chemotherapy is something which should go away or is not effective, because chemotherapy also has cured a lot of patients. So it still stays on as an important pillar of anti-cancer treatment. But immunotherapy has been able to circumvent many problems with treatment, and also people who are not actually eligible for any treatment, they can also consider immunotherapy. They fall into the right subset, the right kind of disease, and they have right immune biomarkers. So immunotherapy has revolutionized the treatment of many cancers and has imparted a much longer survival, even in stage 4 cancers. And in early cancers, as an add-on after a surgery or let's say chemotherapy, it has improved the survival. So it has dramatically altered the way we approach cancer right now.
And in itself, I think chemotherapy is also getting advanced. It's not as crude and brutal
Absolutely,
as it was
the way
before.
it is dosed now, or the frequency it is administered with, and also the supportive care which is now used alongside chemotherapy, like something as simple as anti-nausea care. Because nausea is one of the major symptoms of anti-cancer treatment. So there are better drugs for supportive care right now which are able to prevent nausea to a large extent. So the supportive care has improved dramatically. So the tolerance to chemotherapy, even in those who were actually previously not tolerant, it has improved. So more patients are candidates or eligible for anti-cancer treatment right now. So, science has advanced, and as a clinician in the last 16 years or so, where, since when I've been treating only cancer, I have felt that the treatment has dramatically improved, and the survival has improved, and we have better answers for the people we actually treat, and we owe it to them. Yeah.
Oh, that's amazing, and that's so good to know also.
Yeah.
Without taking much of your time,
Thank
and
you.
that just in the end, would you like to share something with our audience? Any advice that you would like to give?
For the audience, I would just like to say that, it is better to prevent a disease rather than, seek a cure later when, you actually become sick. So I would want everybody to try and do everything under the sun to prevent cancer and prevent disease, as much as possible, because prevention is always better than cure. So I would recommend that everybody exercises, they maintain a healthy body weight, they avoid consumption of red meat, they take adequate amount of fruits and vegetables in their diet, they avoid a sedentary lifestyle, completely stay away from alcohol and smoking and tobacco use, and if you're able to do all that, then to a large extent you are able to prevent, let's say you may be able to prevent about 50-60% of cancers. And if you, alongside that, you're able to screen the right population, and let's say, for example, cervical cancer, there is a vaccine. Human papilloma virus is the causative agent of cervical cancer. So if you take that vaccine, it's also been, made by the government now in India. We have a, Indian version indigenously developed. So if you're able to use that vaccine at the right time, adolescence is the right time to take that vaccine for, girls. And if you're able to screen for cervical cancer when you are, let's say, at a marriageable age, and 2 to 3 years, there is a test called pap smear, which is done for women. You're able to a large extent eliminate the, this, monster disease called cervical cancer in women. And the other screening tools for populations who are at risk, for women, mammogram is a simple tool. Beyond 45 years of age, it is considered, a screening modality. For colon cancer, similarly, you have colonoscopy after 50 years of age. You know, some debatable, also evidence for using PSA and some other investigations for screening for prostate cancer. But to a large extent, if you're able to screen for cervical cancer, breast cancer, colorectal, you're able to prevent many early stage cancers, and you're able to treat them early, and you're able to cure more patients. That would be my message to the audience.
Thank you so much, doctor.
Thank
And
you.
it was lovely talking to you. Thank you
Pleasure,
for
pleasure.
all the key insights that
Thank
you've
you.
shared today.
Thank you so much.
Thank you all. That's it for today, and be safe.